Absolutely. The big story we're tracking right now, Prime Minister Narendra Modi is on a 3-city vaccine tour to personally review its development and manufacturing process. The Prime Minister is about to reach Pune in half an hour from now. And this is the third vaccine facility that he's reviewing today. He'll then take a Mi-17 helicopter to the Serum Institute of India, which is in Pune. After landing there, the SII has partnered with AstraZeneca and Oxford University to manufacture the Covishield vaccine. Earlier today, the Prime Minister visited the Bharat Biotech campus in Hyderabad and the Zydus Cadila facility in Ahmedabad to take stock of the vaccine development activities.
India's journey in the Atmanirbhar Bharat, the scientists, 1800 of them, and 25,000 plus Zydans are continuously thriving and working for providing safe and efficacious vaccine, better COVID treatment and diagnostics.
The Prime Minister will be reaching the Serum Institute of India in Pune at around 4:30 p.m. He's already been to Ahmedabad and Hyderabad, already visiting two facilities of vaccine development, one by Zydus Cadila in Ahmedabad and then the Bharat Biotech facility in Hyderabad. Now, in Hyderabad, the Bharat Biotech facility is in fact an indigenously developed vaccine that will come up from there. This is in association with the ICMR. And as our reporter Sneha Murdani was pointing out earlier, that this vaccine is an inactivated vaccine type that is being developed after having taken a sample of the coronavirus from an asymptomatic patient from India by the NIV. That again was a facility, one of the first few facilities that was doing the test of all the patients who were coming up in India. Since then, of course, the testing facility has increased manifold. Let me go across to Sneha Murdani, who's joining us with more details now. Sneha, I was just talking about Bharat Biotech, but let's look at Serum Institute of India and the vaccine that it's going to manufacture in conjunction with AstraZeneca and Oxford. Help us understand, Sneha, the kind of efficacy that they have reported till now, 70.4%. How good, how safe is that?
Well, you know, Maha, what happened with AstraZeneca is what there was supposed to be, in fact, giving out the data based on the full doses that were administered that showed efficacy of 62. Half a dose was 90. What they did was that they gave an average of about 70%. The manner in which AstraZeneca has handled this in giving out some average of the data has been questioned, for which Astra did say that yes, this is the breakup. So questions were obviously raised, to which Serum Institute also said that we are in fact going to be depending on data only to of course push for EUA in India, because our own phase 3 trials are still undergoing. The efficacy, if you talk about the efficacy, by and large, I would say it's hovering around 62%, because eventually the full dose obviously will be given to the volunteers and not half a dose. And that is something that Astra is also on record now to say that the full dose is around 62%. Having said that, efficacy percentages will be coming down eventually as days go by and as we have more data. The first set of data always gives out efficacy that looks extremely promising. However, there is nothing to really be worried about, given the fact that the WHO zone threshold is over 50%. So even if it comes down a little, it should be okay for us to begin with. The WHO obviously has said exceptional situation, exceptional circumstances, so 50% is good enough. The vaccine has to be safe, most importantly, because you're giving this to healthy people, and at the end of the day, this could carry its own risk. That is a factor that has to be looked at. Now, Serum Institute is saying that it appears they would be in fact somewhere between 70%. However, this is what the CEO of Serum Institute has said. But all of this depends on the data that has been given which of course is going to be available after the completion of the phase 3 trials.
So, Sneha, you are saying that the trials that are being conducted in India, the data for that will be available in December. However, in the UK, Boris Johnson has already asked the regulatory authorities there to look at a pre-Christmas rollout of the same vaccine, the AstraZeneca Oxford vaccine. Is that going to in any way influence what we do here in India?
Yes, if AstraZeneca in the UK gets an emergency use approval, because this has to be under an EUA, then India can use that data. Serum Institute is going to be using that data to then approach authorities in India, the regulators in India, to push for emergency use authorization in India. So that has a direct and immediate bearing on what happens in India, essentially.
All right. Also, Sneha, take us through the details that you're picking up from the Prime Minister's visit to Bharat Biotech facility in Hyderabad.
Well, what we hear is that the Prime Minister interacted with the scientists there. A detailed presentation of the vaccine, the future course of action was given with every indication that things are moving in the right direction. And phase 3 trials, of course, we know of the vaccine has started already. Bharat Biotech's vaccine, it is in fact the only efficacy test that's being done. It's a large trial. It involves about 26,000 volunteers, and all of these details, of course, were shared with the Prime Minister. Bharat Biotech is one of the companies, unlike Serum Institute of India, who say that they will go on to start the manufacturing process only after getting the required approvals. Before that, they're not going to. Unlike the Serum, which has already manufactured 40 million doses of the vaccine already. So that's one fundamental difference between both the strategies of Bharat Biotech and the Serum Institute of India.
All right, Sneha, let me also bring in our guest who is joining us on the show, Dr. Surjit Chatterjee. He's a senior consultant internal medicine at the Indraprasth Apollo Hospital. Dr. Chatterjee, many thanks for speaking with CNN News 18. Now that we are seeing there are at least 3 to 4 viable candidates of vaccines before us, of course, they are still to be given approval. But considering that people are already pinning their hopes on some of these front runners, for the Indian population, Dr. Chatterjee, is there any specific kind of type of vaccine that will be easy to not just administer but to incorporate in the systems that we already have for inoculation?
See, what has been said is that the US developed vaccines, they would require a much lower temperature for maintaining the cold chain, and that could be a problem in this part of the world and in our country. But the Oxford one is the one which requires much lower temperatures. It can be stored even at the normal refrigerator temperatures as 2 to 6 degrees centigrade, which is usually available with us, and the cold chain can be maintained, and it is very cheap. So these are the requirements which our country requires, and obviously the safety measures and the precaution will have to be verified before they are rolled out, which will be done anyway. So the temperature, the storage, the cold chain maintenance, and the fact that it's going to be cheaper, those vaccines are going to suit India much more than the other ones.
Also, Dr. Chatterjee, the type of vaccines that we're seeing, the ones being manufactured in the US by Pfizer and Moderna, are mRNA type vaccines. How are they different from the conventional vaccines? Is it any good relying on these new type of mRNA vaccines which have so far not been explored?
See, once they are rolled out, obviously they are newer technologies, and they are showing, at least as far as time goes, as of today, they are showing a very good efficacy. But only time would tell us in the days to come and in the months to come as to how efficacious they are they able to maintain their efficacy, how safe they are. But obviously, once they are rolled out, that means all these things, at least in the short period of time, have been tested. But since this is an emergency vaccine and things have, this time, the world has really worked very hard. There has been a lot of cooperation between the industry and the technocrats and the experts, and things have happened really fast this time, that the vaccine can be produced in 9 months to 1 year time, which almost hasn't happened earlier. Obviously, we'll have to see in the later days and months to come as to how safe and how efficacious they are. But I hope, and the way the technology is a new technology, but it has proven its worth, at least in the initial studies.
All right. Dr. Chatterjee, stay on with us. Dr. Rajesh Parekh is also now joining us on the show, Director, Medical Research, Jaslok Hospital and Research Center. He's also the author of the coronavirus. Let me go across to Dr. Parekh. Dr. Parekh, Russia has conducted a survey just a few weeks ago where they claimed that 73% of the respondents said that they would want a vaccine against COVID. However, if you talk to a lot of people, there are so many skeptics because of the hurry in which these vaccines are being researched and produced. Is that going to have a bearing on the uptake of the vaccine by the general public? I mean, there are a lot of skeptics.
Oh, absolutely. And but there is a large difference, a not so subtle difference between skeptics and deniers. There has always been a group of people called the anti-vaxxers.
That's true.
They, for some reason, happen to inhabit the United States
Yes.
much more than other countries, and they have been vocally against vaccines. These are people for whom the evidence is just not there, and they do pose a very serious problems. For example, the United States had virtually eradicated measles, and due to the anti-vaxxers, there was a fresh outbreak of measles to the extent some schools had to be shut down in New York City last year. So the anti-vaxxers are actually dangerous to other people. And I think they forget that perhaps the greatest invention ever of medicine is the vaccine. Edward Jenner, 1793, I think it was the 12th of December, when he first saw the results of his smallpox vaccine, that one single vaccine has saved almost 1 billion people so far,
right.
and more than any medicine, more than anything else in history. So the deniers and the anti-vaxxers are a special problem. The skeptics are people who are waiting for more evidence, and perhaps that is entirely justifiable. We've rushed through vaccines at a speed that has, never been seen in human history. And,
Absolutely.
I don't know whether the US government, in calling it warp speed, actually had something at the back of their minds.
All right, Dr. Parekh, I'll come back to you and also to Dr. Chatterjee, but I want to go across now to Herman Gomes, our correspondent who's joining us live from Pune, where the Prime Minister is going to be reaching in about 15 minutes from now. Herman, what is it exactly that the Prime Minister would want to see at the SIF facility, considering that they will be out with their trial results in December?
Well, I'm outside the Serum Institute of India, and we do know that they have partnered with Oxford University as far as and AstraZeneca as far as the COVID, the COVID shield, as it's being called here in India. Now, at this point, what we're told is in the next 5 to 10 minutes, he is expected to be present here, to arrive here at the Serum Institute of India. I'll ask my camera person to show you the visuals there. It's just a matter of a few minutes before you have, say it's the next 5 to 10 minutes before he arrives here. What happens here? Well, we do know, as we are pointing out, that the third phase of the trials is still undergoing, but the data for which needs to be still deduced and needs to be made available, that's going to take place somewhere in December. Now, once he arrives here, what we're told is that he'll have a brief tour of the place of around 10 minutes. Post that, a 15-minute closed-door meeting with the Poonawallas of the Serum Institute of India, as well as other scientists who have been working here. And after that, he has around 25 minutes.